Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
They hurt right here, and sometimes it's sharp, and sometimes it's achy.
How long has been going on?
Maybe a year.
A year? How did you hurt yourself?
I think it's from the cell phone.
Okay.
I think from
a lot of typing.
Typing on the cell phone.
Okay. So this been
this
going.
one's numb a little bit too.
So you have numbness on the right, on the top. Okay. How much numbness from 0 to 10? 10 is emergency room.
5.
5. That's constant.
Yeah, pretty much.
Constant.
Although sometimes it's a little bit more when I use the phone more.
Okay. So what about the other pain in your?
The other one hurts sharp sometimes, and mostly when I open a jar or pick something up heavier.
How much pain at worst when you open something or lift something?
Probably 6.
6 out of 10.
Maybe 7.
It's your right thumb or left thumb is worse.
Is worse.
Left
But it
thumb.
doesn't have any numbness.
So the right thumb has the numbness and pain. And what about the pain? Do you have constant pain in your like dull aching pain, or just when you do
just
motion?
when I move.
When you move it,
Or
okay.
after I've been moving.
Okay, so we have a weight here. We're gonna test it with the weight, and I want you to lift it and let me know how much pain and where do you feel the pain. Okay, all right. So we get you the weight. Here you go, and do the motion. So we can use that before and after. So I want you to get
a certain way.
So bench grip. Yep.
Maybe like this. Yeah.
Yep. How much pain? How much?
8.
8. Okay, let's do it with the other hand.
This one doesn't seem to have it.
So it's worse on.
So
that's 8. Right here.
Ah, yes.
Sorry. Okay. So that's painful. Yeah. Okay. So it's all in here.
Just that pointy bone.
What about here?
Oh,
there you go.
Same thing, pointy bone.
Don't hurt, okay?
Yeah.
There you go. All right. Now we found the 2 spots here and here. Okay. And the numbness in the front or in the back?
Both.
You feel it?
Both.
Like around
all around and the top.
This area. Okay. So it's numbness in here. Okay. All right. Okay. So let's work on that, and we'll see how you do. So you start to feel that numbness, and you said you do bowling a lot or something?
Bowling, yeah.
Yeah, okay.
But I never felt that.
Okay.
Only since the phone.
Okay. So can you tell a difference now in the numbness? 0 to 10?
I don't know, on the right side doesn't seem to have it.
So it's gone?
Well, maybe 1.
1 and
the rest of
Okay. So it was
the
5.
Rest of it. Oh, yeah.
It was 5 when you came here. Okay. So let's see how is it now. Okay. How about now?
Better.
Numbness or is gone?
No, numbness is still, but not both sides are better. The
0
top
to
still
10?
has.
0 to 10?
Maybe 1 or 2.
Okay. So you're gonna work on the scar tissue now, okay? Make sure it's not painful. You feel this scar tissue? This is bump.
Oh, yeah?
And you can see it actually in the camera.
Oh, it goes all the way up, huh?
All the way up, okay. So if she does not have a scar tissue, the instrument, oh, that's a bad example. Okay, you can see that the instrument is just not smoothly moving. You see that?
Yeah.
It's just curving. Yep. So that's a scar tissue. In the perfect scenario, let's see. Like here, you see, there's no scar tissue. It's going nicely and smooth. There's no bump.
Okay.
Yeah, you feel, and you have a scar tissue all over here. And this is the area.
That's probably why it goes up the arm.
Yeah, this muscle is attached from here to here, so we have to loosen up. So why scar tissue is an issue? Because our muscle should act like a rubber band. When it contracts and relaxes, it does this. So when you have a scar tissue, it's like you have a knot in the rubber band, so when the muscle contracts, it does not stretch much. And when that happens, so it decreased range of motion and compress on the joint here. So when Dee was trying to lift weight, that was hard for her because the muscle is not lengthy. So it
up there too.
yeah. So you see, gets a lot of scar tissue. Sorry.
Tender.
What about here?
Yeah.
The weight.
Again.
And we see how you're doing after holding the weight. Okay.
It's still kind of weak.
Weak. The weaknesses we're gonna work on, but the pain.
Yeah, the pain is going pretty much gone.
Yeah.
Maybe one.
The weaknesses, that's we're gonna do strength for that. What I'm looking for is the pain.
Pain, yeah.
How does that feel?
Nope. Yeah, no problem there.
All right. So
It was about 3 years ago.
3 years ago,
We worked on the knee.
we walked on the
I
knee.
could barely walk.
Yeah, I remember.
Walk across the room.
Yeah. So you were with like, I think you came with the crutches, or you came with the walker.
Oh, the walker.
Walker. Yep. That was 3 years ago.
Yeah.
And how many treatments before when you stopped to use a walker?
I don't remember, just a couple, I think.
Couple of treatments, and you can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to ASTRinstitute.com.